Hello guys, I'm here for our beginning classroom. Today let's go talk about navigating pregnancy during the coronavirus disease, COVID-19 pandemic and expert middle wave, and how to best protect yourself and your body. Class, pay attention. Let's go work here about the COVID-19 because it is the film that causes more fear for everybody. So we have here a picture that is a woman hands in with your baby, with your no, baby her, because the baby is not smiling. And we have a text here that I will read for you, and after we make the questions. Today is not this day, 11th May 2020. Today is 12, and the notice says what? It's about UNICEF again. Pregnancy is a special time full excitement and anticipation, but for expectant mothers facing the outbreak, the coronavirus COVID-19 fears. COVID-19 is the name, a world name that is given for this disease. Fear, anxiety, and uncertainty are closed the outside happy time to learn more about how women can protect themselves and their little one. We spoke with Franca Kadi, President of International Confederation of Midwives. COVID-19 is a new virus and research into ongoing. We will update this article of new information becomes available. It's safe to continue prenatal checkups. Many expectant mothers are fearful of going to appointment while they are taking precautions, such as staying home and practicing physical distance when outside. You do see a lot of adaptation happening in the moment in the world where midwives are doing clinics and certain appointments by phones, so that the actual looks at the baby and the work. The baby appointments can be short, says Kadi. I expect that pregnant women will find they are seeing their healthcare careful professional less to protect them and the healthcare professionals from getting infected and that they will be seen leave when necessary. Modifications may also tailored for individual patients depending on their receptive respective conditions, for example, hours versus higher risk pregnancies. Kadi advised mothers to find out that options are available to them from their healthcare professional and their communities. The person who's taking care of you is perfectly geared to you and your own needs. So your midwife is obstetrician will know best. After your child is born, it's also important to continue receiving professional support and guidance, including routine immunizations. Speak to local healthcare provider about the safest way to have this appointment for you and for your baby. If I have condition coronavirus disease, COVID-19, will I pass to my baby? We still do not know if the virus can be transmitted for the mother to the baby during the pregnancy. The COVID-19 virus has not been found in vaginal fluid, it's called blood and bleached milk. Says Cadet, although information is still emerging. To date, COVID has also been detected in amniotic fluid of the placenta. The best thing you can do is take of necessary precautions to prevent yourself from contracting the COVID-19 virus. However, if you are pregnant or have just given birth in few you, then you should seek medical care promptly and follow instructions for your health care provider. I was planning or giving birth in the hospital in the healthcare clinic. Is, still, is this still a good option? Women would ask their midwife of healthcare professional what can feel the safest place of them and how precautions are being taken for situations of two situations, recommends Kadi. It depends to the woman on the situations or the health care system. You hope that most healthcare facilities have different facilities where those with the COVID-19 virus go one entrance and one towards the mother. But in some situations that's totally not possible, says Kadi. In certain high-income countries like the Netherlands, where I come from, we have a system whereby from birth and integrates within the system. So home birth within the system is safe and you are seeing more women giving birth at home. But this is certainly not the case in most countries. And even certain hotels are being used in the networks by midwives for women to able to give birth of the hotel which is made safe for women to give birth. So she does not have to go to the hospital, but that is very important, very much within that local context. For the safest option for you, it's important to speak to a healthcare professional who is supporting throughout your pregnancy and birth. Can my partner or family member to nearby when I gave birth? While policies vary by country, Kadi believes women should have someone nearly to support them, as long as the proper precautions are taken, such as wearing a mask while in the delivery room and washing their hands. We are finding that in certain countries, people being allowed to be with women, and that's worry me. I can understand that I want to reduce the number of people with a woman while she is giving birth because we're really trying to reduce contract. And that's very, 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 very logical. But let's make sure that a woman has someone, one person with the while here she's giving birth. Her partner, her sister, her mother, or closest person of the choice, and please keep the babies with the mother. We have no compassion and understand each situation as it is that the healthcare professional together with the family members are going their best, using their common sense and listen to each others. I think that's very important that we try to work as a community. I feel incredible anxious about giving birth. What should do I do a cope? Have a plan in place for your birth can help ease feelings and anxiety by giving you more of sense of control, but recognizing that currently situations means there may be less predictably depending where you live. This should include who the phone when labor begins, who will provide support during labor and where, establish what restrictions will be placed for hospital birth regarding support people and family members, advised Kadi. She also recommends do simple things at home to relax, like like exercise, breathing exercise, and give your middle wave a call to your need to. Focus on taking care of yourself as much as possible can. Eat well, drink well, put your hands on your belly and enjoy being pregnant. What questions should I what questions should I be asking my health professional? Kedi underlines the super importance of establish a trusting relationship with the health provider. All those the questions that have to do with and to health, I can would ask them freely if you have one open relationship with your healthcare provider, with your midwife, with your obstetrician, then we'll discuss these things with you and your answer openly. It's your absolute right to know that things can, because it's your body, it's your baby. Midwives is responsible in increasing demands of their services are as are doctors and nurses, and so may take a little longer to respond. Kaji notes. She suggests establish a system of how and when to communicate and your health care professional. For example, organize a routine around the appointment and how to get touch for urgent care. It may also be helpful to talk to care providers and advance about obtaining a copy for your health records, including records of prenatal care, in case of any disruption or change in the service. When it comes when it comes to your plan to give birth, it's important to ask many questions and you need Kadi suggests following. Now class you go finish it. I'll read the finish it. You go finish the and do activity on classroom on the Google. Okay? Thank you for your watching.